Okay, our registration numbers and folks logging on has slowed down just a little. So we will go ahead and get started with today's webinar. We do have a limited number of folks joining us today. We have Val is out, and so are a couple others. So today we have Angie Brenner with us and Carrie Tessero. Before I hand it off to Angie, one thing I do want to remind you of is there was an email blast that went out this week that mentioned the addition of the vaccine accordion on our division webpage. So know that all of the information that we have been putting out regarding the vaccine now has its own spot on that COVID page. And then I'm sure Carrie will talk about a lot of those resources soon. The other thing I wanted to let you know, and I put it in the chat box when we started, please do not send your messages, your questions just directly to the host. Those are going to come straight to me, and I promise you that you would rather Carrie answer those questions than myself. So with that, I will turn it over to Angie.
Okay, good morning, everyone. Sorry you have a small team today, but hopefully we will be mighty for you. I just have a few things to go over. I want to talk to you a little bit about budget. We have explained in the past, we submitted our fiscal year 22 new decision budget items back in October, and that included utilization of $5.9 million total with $2.3 million general revenues, and that was to address the waitlist reserve that was released. And then the cost to continue will be included in that, and that is $9.2 million total with $3 million general revenue. And then with the budget, the governor's recommendations, we have some additional new decision items that we have submitted, and so I'll run through those with you quickly. And that would be DMH utilization that we're submitting for the number of new clients estimated to be served in fiscal year 22 that would have otherwise been added to the wait list, and that's a total of $16 million general revenue for DD to the $48 million. So it's in-home would be 1,284 individuals that we would be able to serve. And then for residential, 428 individuals. The DD waitlist, the cost to continue, that's for continuing the funding for the full year of services that we added in fiscal year 21 as a release of the restriction. And that is to serve an additional 1,005 individuals for in-home and an additional 188 individuals for residential. And that's $6.9 million general revenue, $21 million total. And then we are sending over a new decision item for DD rate standardization, and this is for our residential services. This funds a 3% increase from 77.7% to 80.7% of that lower bound from the rate study. So that's a $9 million general revenue, $29 million total to those rates. Then there is a DD market-based rate adjustment, and this is $1.4 million general revenue, $4 million total, and this is really the rate adjustment for that DD personal assistant services to equalize with those personal assistant service rates paid by Department of Health and Senior Services. And then finally, the last one that we added would be for DD telehealth. So this is really to continue that service that we're receiving through Station MD. So we're really excited about this one as well. That is $1.5 million general revenue for a $4.5 million total to add to our services. And we do want to continue working on getting that into our waiver. So we'll likely go through our Appendix K first, and we'll see how we do with CMS on that. But that would be for after July 1st. So the department division, we still continue to work on that. So we'll keep you posted there. It's a great service to continue. As far as federal programs, we still have all of our waiver renewals and our amendments that we're working on. So again, if we didn't have all this COVID stuff, all of the waivers would be like the bulk of our conversation. So we're continuing to work through those. Our federal programs unit, they're adding their formal public comments to the comp and the CSW renewals, and with the Partnership for Hope and the MoKids amendments to align with those renewals. And they're intending to send those to MoHealthNet early next week. We are doing an adjustment, or we're doing an amendment to the community support waiver since we did have the release of funding for the wait list. We are increasing our unduplicated participants to 4,800 with the proposed effective date of April 1st. and that is already over at MoHealthNet, and it is under review, their review right now. And with that, I'll turn it over to Carrie. Hopefully Carrie's able to join. I'm not sure if she's on yet from Fusion Cell. But what I'm going to do, I'll continue to kind of monitor the chat, and we will answer as many questions as we can today. But any that we miss, we will make sure to reach out with you with those answers. So with that, I am going to turn it. Oh, let me check the chat real quick. Make sure I don't have any. Let's switch around. All right. Okay. So with that, I'm going to turn it over to Carrie, and I'll continue to monitor the chat. So thank you all very much.
Carrie, if you're talking, we can't hear you.
Thank you. That double meeting thing is getting me. Could you give me the ball, Heike? I can't take it from you.
Absolutely, all yours. Or it's trying to get to you.
Perfect.
There you go.
So good morning, everyone. I am going to start with information from the Fusion Cell, just generalized COVID information. This is the daily situation report that they share with us every day during the Fusion Cell, and you can see the big takeaway from this slide is this continuing downward trend that we're seeing in data. Overall, our data is really trending downward as far as cases go, as well as positivity, so that is all really good news. We're seeing that in every region of the state pretty much, and we are also seeing that in a lot of the country. And I also wanted to share with you our latest map for our transmission rates. And so this is the transmissibility of COVID-19, and anything above a 1 is really not a good place to be. That means that we are growing exponentially still in the number of cases. This particular model is based on hospitalizations, and you can see for the first time in a very, very, very long time, our transmission rate as a state has come down to below 1, and so that's fantastic. When we are below 1, and the further below 1 is where we want to be, the lower we go, the better. When we are below 1, that means we are not growing. We are actually truly decreasing in the amount of COVID within our state. And you can see multiple regions, Northeast, Springfield, Cape Girardeau, St. Louis, have all shown below 1. We've had a couple of different times over the course of the summer, fall, and winter where a region here or there will be below 1, but this is the first time that we have had so many regions below 1. And so this is really good news and just also reinforces what we are seeing in those downward trends of COVID in our community. They also shared with us a couple of other different models that look at COVID differently. Before I jump to those, I will show you this one. This is the trend of our hospitalizations. So the different colors represent the different regions around the state and what portion they make up of that overall number. But the big takeaway on this, again, is back around Christmas, really from Thanksgiving through Christmas, we were seeing rates of hospitalizations in Missouri between 2,800 and 2,900,000. Or not 1,000, I'm sorry, 2,800 and 2,900 individuals hospitalized on any given day with COVID, which is an incredibly high strain on our hospitals, and that has dropped dramatically over the last several weeks as well to where we're now around 1,600 admits every day. So that's a very good trend for that as well. As far as those other transmission rates, these are some different models that have the same information, but they base it on cases instead of folks hospitalized. And you can see that really we are matching across the board. We're a little bit lower on cases, and that would make sense because hospitalizations tend to lag behind. So that data you'll see improvements in that data a little bit later than you do in the cases. And so that is good as well because we are matching across all these different models that we look at. So that is what I wanted to share today about COVID, but I also wanted to talk some about vaccine, and so I'm going to show you, this is the Show Me Strong webpage that Missouri has put together. This is where they will be tracking vaccine in the state, so I'm showing that to you. This is the main homepage, showmestrong.mo.gov. If you go to the data section, choose the public health data. This will bring you to both the COVID data, which I was just showing you some of that. Hopefully it doesn't take too long to load. So it'll start with this Missouri at a glance, and they have added a vaccination section to this front page so that you can see how many doses have been administered throughout the state in the last 7 days, as well as the rest of that regular COVID data that is out here. But they have put a specific tab together for vaccine. And so you can go out there. This is public facing, available to anyone. You can look at this anytime you want, but what they show, what we have on this website now, is the total number of doses that have been administered in the state of Missouri. We're sitting at just over 600,000. 488,000 folks, almost 489,000 folks have received at least one dose, with 143,000 have already received that second dose. We're currently at about 8% of the eligible population to receive vaccines have received it in the state. That's a good number as well. 2.3% have received those 2 doses, and then the same number that's been administered in the last 7 days. And then they've charted that as well, so you can see over time the number of doses being administered. We are a bit behind in data reporting, so for lots of reasons, it's a lot of information to be put into the system from lots of different places. But also those providers, those mass vaccination clinics, those healthcare centers, even our own at DMH, frequently when people are putting shots in arms, they're doing dozens to hundreds to, in some cases, a couple of thousand shots over a course of a few days. And so it takes a little while to get all that entered in there, but it will get entered, it will get updated. They have also done a breakdown by age group of individuals who have received the vaccinations, and you'll see that so far in Missouri, about 24.8% of those in the 85-plus age group have received a vaccination. That is because there was clearly a focus on this group with the long-term care efforts. This age groups, the higher age groups, do suffer a significant proportion of the fatal outcomes from COVID-19. So there's a lot of emphasis on these age groups, so it makes sense that we're at those percentages. We are seeing it come up in these younger age groups. Primarily, these are the folks who are working in healthcare and in a lot of those healthcare settings and those long-term care settings, and individuals who have been eligible to receive vaccines. So we'll see more movement in these age groups as these tiers continue to be opened. They also break it down by sex and by race. You can see that females are at about 10%, while males are catching up now. They're at about almost 6%. This information I would caution you on, they don't get it for everyone. We try to get it for everyone, but if folks don't fill it out, we simply don't have that data. It's not surprising to see this breakdown between males and females when you think about the breakdown of those who are working in those healthcare industries that were first eligible for vaccine. But as we're moving into the phase 1B tiers, we are seeing that gap decline. For the share of population by race, we have a large reporting here in the multiracial category. They are checking that to make sure that it is not a data quality issue, but this is something that we're seeing nationwide, not just in Missouri. And while it's fantastic news and we hope it to be true, one of the issues that we also believe may be impacting this is that these percentages are based off census data. So we have our number of individuals that fall into this multiracial category, and then we take the number of individuals who report that they're multiracial, and that's how you get that percentage who have received the vaccine. Historically, these populations have been undercounted in the census, and so we're concerned that that is part of the reason for these large reporting numbers in those categories. And then finally, this may be really interesting and very beneficial for all of you. They are tracking by county the number of individuals who have received their vaccine and the percent of those populations. And so you can see this for every county. You can sort it by county. You can, by clicking here, I can sort by the number of those who have received, well, it's not going for me. I said it would work, but nothing likes to work when you're doing it live. There we go. So now I've sorted it by the number who have had total administered doses, and so you can see which counties have had the most doses. I would not necessarily take a lot from this because St. Louis is the largest county, so of course it should have the largest total number of doses, but looking at those percentages is an interesting way to look at it. You can see which counties, and there's also some caveats here because Shelby County is showing as the top one, but you've got to keep in mind, I'm not sure which one it is. I'm geographically challenged, so I apologize. But Shelby County has a very small population compared to so many other counties in the state, and they do have a lot of folks in those long-term care centers as well, and so that will make an impact on these percentages. But you can absolutely look at this for your own counties, and when you are making decisions about engaging in the community, I would encourage you to take a look at this data to see where your county stands and what your percentages stand, and combine that with what you know about the individuals in your care and your staff and their vaccination status. Okay, so that is the public vaccine dashboard. There is also the COVID vaccine. It's covidvaccine.mo.gov. I point this out because this has a lot of really good information. You can use this within your facilities, within your entities, but also sharing with friends and families. You can share on your Facebook pages, et cetera. They really have put together a ton of information for this website, so if you have not been on it and you have not seen it, I would encourage you to do so. This Get the Facts section is fantastic. They have a lot of information on this section about rumor controls, frequently asked questions on all of these topics. It's very good. They do keep it updated. They also have this video right here. This is what we call our Dr. Thomas video, and if you haven't seen it, it is a fantastic tool to share with those who work for you or folks in your care or even your friends, family, and community. And it talks about a lot of different myths and concerns that people have about the vaccine. And so it just really provides that factual information that can help people get a better understanding of the vaccine, how it was developed, and make an informed decision about whether they're ready to get the vaccine or not. And so that's a fantastic tool. I greatly recommend it. Highly recommend you watch it and share it with others. It also has this events sign up. This is new, and so it does have this disclaimer on it that you should go to the same place you went to for your first dose. Wherever you got that is where you will get your second dose, so you will need to click that. But it does have regional information about mass vaccination clinics. Now, I will caution you, when you come to this page, frequently when they put these events up, it will have these boxes at the bottom. They are full. Folks have already signed up, and I totally understand the frustration with that. Many of these places have lists already. I encourage you, if you're still trying to get friends, family, or even your individuals and staff members signed up, and you're going through this process, to reach out to your hospital centers, your providers, your local public health agencies, and get on their list that they have going on. But they will be adding events to this every week. They will be continuing to go to each of these regions every week, at least through the month of February, and most likely into March, to provide these vaccines and get them out to people who are eligible. And I do foresee them going on longer, especially once they open additional tiers. So that is a really good information and things to keep in mind and to watch this page as well. There's also good information about your specific populations, your tiers, where you fit. This is information for the residents. You can get to it in many places, but the phase 1A, so they do spell out who fits in the 1A phases. And many of our providers, you do fit in these 1A phases. All of our providers should fit in this 1A phase, and definitely into the phase 1B, tier 1 of phase 1B as well. And then our high-risk individuals fit in phase 1B, tier 2, if they were not incorporated into those upper phases. So all of those folks should be eligible to receive vaccine for now. Many of these people in this area will need to be working with their medical providers in order to access vaccine. And that is, I think, the bulk of what I was going to show from this. Oh, I did want to talk about one thing, though, with the vaccine, and I think this is really important to communicate when I talked about that Dr. Thomas video. And she talks about it a little bit in here, but it's really important that folks understand that you can still get COVID-19 even when you get the vaccine. So there's a couple of reasons for that. The first one being that if I get my vaccine on a Monday, I could easily have unknowingly been exposed to COVID-19 the prior Friday. And so when I get my shot, it will take a solid week or so before I come up to about 50% protectiveness from that shot. And if I had been exposed prior to my shot or even after my shot, I still have an opportunity to get COVID-19, to contract it, because I've only reached that 50% protectiveness. So it's not unusual to hear that people get a shot of their first shot of their vaccine and that they may contract COVID-19 prior to getting their second shot. That's to be expected. It can happen. And then even when you get that second shot, it's still going to take you at least a week, maybe up to 2 weeks, to get up to the full protectiveness of the vaccine. And the full protectiveness of the Moderna and Pfizer vaccine is somewhere between 95 and 94% protectiveness from contracting COVID-19. So there's still a window there. There's still a 5 to 6% chance for individuals who've received both doses of vaccine that they may contract COVID-19. And we have seen some examples of that. We have seen some folks who have still contracted it. But what is really great about this vaccine are those individuals who still contract it. Almost 100% of them are asymptomatic or have incredibly mild symptoms. They do not get seriously ill. They do not wind up in the hospital, and they are not dying from COVID-19 if they have had the vaccine. And that's really the point of the vaccines, is to prevent hospitalizations and to prevent death. The fact that we can prevent 95% of the infections is fantastic, but the fact that we're preventing virtually 100% of hospitalizations, and to my knowledge, no one has died from COVID-19 who has received a vaccine, so 100% of those fatalities are prevented, is really fantastic news. And that's something to also keep in mind as other vaccines come online and get approved. Johnson & Johnson will be going before the FDA, I believe on the 26th of February, seeking their emergency use approval. Their effectiveness for preventing COVID-19 is a little bit lower than the Pfizer and the Moderna. It's around 60-65%, but it is still showing that same nearly 100% effectiveness at preventing hospitalizations and mortality or fatalities from this virus. So when these other vaccines come online, folks should not be waiting or trying to pick for one or the other. If it is safe for you to get the vaccine or safe to get a vaccine, you can absolutely take whichever one is available, because they are all showing virtually 100% effectiveness at preventing severe illness, hospitalization, and death, which is what we really want to prevent. I'm going to stop sharing my screen at this point, or actually I can pull the chat up and start looking at the chat and see. Is there information in any of the sites regarding the variants and if they have been seen in Missouri? I'm not sure if they're updated on these websites. At this point in time, we have not detected any of the variants in Missouri. However, when I say that, UK variant was detected in Kansas, which is our neighboring state, just this week. So, you know, it's probably here. We just haven't detected it at this point. All of the information that they're showing, the research and the studies at this point, indicate that the vaccines are still effective against these different variants. The one that is most concerning is the one from Brazil. But even with that one, they're still showing that they are maybe not as effective at preventing infection, but still as effective in preventing serious illness, hospitalizations, and fatalities. So that is really good news. In addition, with these messenger RNA vaccines, which is the Pfizer and the Moderna vaccines, they are already looking at tweaking. That's one of the really great things about that messenger RNA vaccine. They can make tweaks to it very, very quickly so that it recognizes those new variants, and they're already working on doing that for future rounds of vaccine. So if the virus mutates too far they'll still be able to address it. So that's really good as well. Any other questions on vaccine or COVID? I'm not seeing any. Oh, there's one. I'm not sure I can answer that one. I'm not sure which system. Is there a status update on receiving test results from this week as the system had issues? Do you know which system? All right, well, not seeing any other questions in the chat. I'm going to stop sharing my screen and I will turn it back over to Heike and Angie.
All right, everyone. I don't see a response coming in regarding that status update and with regard to what system that is. However, if you do have an additional question about that or want us to help you dig into that a little further, feel free to drop an email. And with that, that concludes what we have for you today. So oh, wait a second. Says, no, we were just notified that the system had issues. So, again, I think as Carrie mentioned, not sure that we have any information on that part. So with that, we will let you go about the rest of your Friday. Have a wonderful day. Thanks.